Do you know the United States Congress just revoked federal support in 2012 for needle exchange programs? America dragged up the rear, brought up the rear in implementing needle exchange compared to all of Western Europe. We had a second wave of AIDS infection from homosexuals to needle injectors, which England and Australia didn't have. Despite that massive public health evidence, we finally got dragged on board, and now we've just last year revoked that. So that's obviously America's not the whole world. We just determine what the rest of the world does. What we decide drags down the rest of the world. So in that one area where there's no serious public health advocate who doesn't understand and argue that clean needle programs are a public health plus.
Harm reduction has been used effectively in a number of countries. If Kenya implements the needle exchange program, then it will be the second country in Africa from Mauritius.
To call it a needle exchange program is to summarize too briefly and almost inaccurately the concept and thinking that is behind what has been known to science for a number of years. We know from science are the following. Number one, that there is a link between HIV/AIDS spread and injecting drug use. Secondly, we know that injecting drug users are a very important and growing pool and source of HIV infection. And the third thing we know from experiences elsewhere is that once you start reducing the number of people who are HIV infected and who inject drugs, you reduce the transmission of HIV in the general population.
This could be a timely program for Kenya, given that HIV and AIDS has no cure yet, but drug abuse can be treated.
Reducing the transmission of HIV, it doesn't increase the level of drug use. In other words, it will not make people use drugs just by the fact that they're being given needles.